Good afternoon, everybody. Welcome to Nottingham City ICP Learn and Share. My name's Tracy Tyrrell, and I'm delighted to welcome you all to this afternoon's session. So we're really pleased to welcome Richard Holland, Assistant Director, this afternoon to talk to us around Nottingham City Homes. So we're going to follow our usual format where we'll have a presentation for 20 minutes. We invite you to put any questions you have in the chat box, and then we'll be having 10 minutes at the end for those questions. Okay then, so a very warm welcome to Richard, and over to you, Richard.
Thanks, Tracy. Thanks, Mars. We'll start with the first slide. So we are Nottingham City Homes. What are we? We're an ALMO, which stands for an Arm's Length Management Organisation. Basically, we have one shareholder, and the shareholder is Nottingham City Council. We have a board that runs the organisation that oversees our activities, and that's made up of tenants. So it's equal split between tenants, people from the private sector, and also councillors. So they make up the board. One of the things that I want to highlight is our vision. Our core vision that all our colleagues know about is to create homes and places where we want to live. And hopefully all the activities that we do as an organisation revert back to that. And that's what we're about, trying to create homes and places where people want to live. I kind of detailed our values there, and you can see that they're listed, and it's really interesting how you can see how they will link into the work of the ICP and City Homes' role in the ICP. So we're passionate about delivering services. Hopefully that will come across through later in the presentation. We respect our colleagues, residents, and definitely our communities. And I think this is where the next three values really hit home are about ways in which to improve. That's what we see as being part of the ICP. We help to improve the services to our residents, to the wider Nottingham communities. We provide great value for money. Again, that's what we think we do as an organisation, and being part of the ICP will help us to deliver that, sharing our resources, which we all know are very precious this day and age. And we work effectively with each other, with our residents and our partners. Again, being a part of the ICP, it's all about partnership working. The next slide, please, Mars. Okay, I'm just going to provide some context around Nottingham City. I'm sure most colleagues will know this. Nottingham is very much a deprived city. It's ranked 11th out of 317 councils in the country. That there are definite issues of poverty, and the issues around poverty will also impact on health issues that arise from that and the associated issues that come from it. It's also important to say that we manage the waiting list on behalf of the City Council. We have 8,000 people on our waiting list that want a home in Nottingham. This is a massive demand that we have. Simply demand exceeds supply that we have. There is an awful lot of people that want to live in a home that we're unable to meet their requirements for at the moment. And looking at the forecast with the anticipated increase in homelessness, I think those numbers will only go up. And I think it's also worthwhile pointing out, some of the context which we deliver our services. I'm not sure if all colleagues are aware, but around 30% of people employed in Nottingham have been furloughed. This is big amounts, and if you think about that, there is a reduced income, and that does, having reduced income will also have the associated impacts on health. Next slide, please, Mars. Okay, so I'm kind of give an overview of Nottingham City Homes. I'm sure a lot of you will see our vans going around the city on a daily basis. We cover all parts of the city. I'm pleased to say that we are going electric soon, so that the vans that you see will no longer be there. We are trying to make sure our fleet is electric to meet the green agenda. Nottingham City Homes, we have 1,000 employees doing various works across the organisation. We manage a massive over 27,000 properties, which is around a fifth of Nottingham households. So a lot of people are kind of, have contact with our services. Each year we let over 1,000 homes. The numbers have gone down in recent years. People are staying put. We don't get such a higher turnover rate that we have had in previous years, but we have at least 1,000 homes each year turnover. I think an example of something we're particularly proud of is we're the only Nottingham-based organisation to be a top 100 apprentice employer in 2020. We kind of insist that a lot of the partners that we have employ apprentices that are invariably from our council estates, younger people that might be struggling to get on the labour market. This is something we as an organisation do, and we try and put that into the partners' work to promote apprenticeships here. Probably, another fact is that we have around about 7,000 of our 27,000 tenants are in receipt of universal credit. We anticipate this rising to around about 12,000 tenants in total by the end of the full rollout of universal credit. So that's a lot of people that are living on the benefits system. But we are a forward-looking organisation. We've built almost 700 new homes since 2005. We have this programme whereby we do sell properties under the right to buy. That's legislation. We have to do that, but we try and replace them. Unfortunately, not at the same rate as we sell them, but we do try and replace them with really good quality new homes. One of the schemes that we do is called Women in Construction Programme, where we brought 1,000 people into our jobs or into training with the organisation. Something that we proudly promote is having women get involved in the more workforce side, so becoming labourers, plumbers, electricians, plasterers, etc. We try and give people opportunity to develop themselves. We have maintained our services throughout the pandemic. We've made over 60,000 calls to vulnerable residents, and we have continued to deliver at least 40,000 emergency and urgent repairs across the city during the past 12 months. One thing about having the big reach and the numbers that we have living in our accommodation is that we do have a big reach out there, a big reach on social media. We have a lot of followers on our Twitter site, on our Facebook site, but we also write to every single resident at least 4 times a year. And we kind of use our partners as well. We try and promote the work of our partners in that to try and, do some campaigning. I've been involved in the past in looking at, can we promote foster care and things like that to our residents? And so we do get involved in issues around that. Just saying, we have 68 independent living communities across the city. So these are what some people know as sheltered housing. We have 68. So a lot of our stock is concentrated in this type of service provision that we have. A couple of other things that I kind of wanted to mention, that each year we have £110 million to collect in rent. So it's probably one of the reasons I don't sleep that well at night. But we have a big amount of rent collect, and the rent that we collect it's ring fenced to tenant services. So we put that back into the services that we provide. I also look after 2 hostels within the city for homeless families, and again, one of those we are undertaking doing lateral flow testing as part of ICP work and wider health work for the residents that are living in our hostel accommodation. I'm going to talk about some of the stuff we do around food banks. We give out vouchers, and we do a lot of work with children's homes. Something I've been heavily involved in is the work that we have done to provide many children's homes around the city. So next slide, please, Mars. One of the things that I'm going to try and concentrate on the next few slides is talk about some of the health-specific projects that we've done and the impacts that they've had. Colleagues may be aware of the hospital to home service that we do. This is a service that we provide to either stop residents or citizens going into the health service in the first place by providing with good quality accommodation, or once they have been hospitalized, we try and help find them accommodation once they to help speed their discharge from the hospital. And ultimately, we do provide good quality accommodation, and and the kind of the sort of the pro quid quo for us of that is that we let some of our homes that we may not have such a strong demand for. The hospital to home service is jointly funded through CCP and ourselves. We have that, and what the satisfaction rates that we're getting incredible. 9 out of 10 people, 9.8 people out of 10 are satisfied with the services. I think that the next information there is something that is often lost, but it's 97% could not have moved without the service. So this will be whereby we have somebody that is based, one of our housing to health coordinators will be based in either the Queen's Medical or the City Hospital, and they help to kind of facilitate discharge, working alongside the discharge coordinators, occupational health, GPs, CPNs, etc. And what we try and do is give people options or understand where people want to move to. But a big thing is if you're socially isolated, or you live alone, or you have underlying health conditions, moving is, you know, a tough job. It's hard on as a move house at any time, but moving when you're ill or you're socially isolated, that's where we step in. That's where our housing to health coordinators will step in, and what they will do is they will look at arranging furniture removals. We will sort out benefits, getting gas and electric on, all things like that. The impacts have been absolutely amazing. You can see the number of bed days that have been avoided there. We can see improvement in mental health well-being, 86%. So what we would do is we will ask somebody 6 months after they have been rehomed into one of our places or one of our properties or one of our partner properties. We'll ask them how they're improving, you know, and this is very much a self-judgment case. You know, and you know, we've seen that, you know, great results around anxiety and depression as well. So if you want to kind of next slide, please, Mars. What is the outcome of that? Well, over the 4 years now that we've been running the service, absolute massive savings have been achieved. Around 1.7 million, you know, has been kind of audited that we have saved against. What I can do through Tracy or Mars is I can give a full copy of the report for colleagues who want to know more about the service or look into where these figures come from. But, you know, it is an impressive set of figures that we have produced, that we have done it in partnership with the CCP, etc., and health agencies. We have worked together to deliver these massive savings, so much so that it's been recognised by Health England as an example of good practice. So it's something, again, we are very, very proud of, and again, where City Homes is involved in the health agenda. Next slide, please, Mars. Okay, another example where we've worked together as part of the ICP is a scheme called Housing First. We've been doing this since autumn 2019. Housing First, for people that don't know, is about rehousing rough sleepers, people that are entrenched in the rough sleeper way of life, and we're moving them into more settled, permanent accommodation. You know, the cohort you may have seen sort of outside coffee shops, outside railway station, things like that may be begging and things like that. These are people that we worked in partnership with other ICP partners such as Framework, who together we come together and provide a wraparound support service for people. You know, it's kind of interesting that the health angle gets played in here. You know, we see rough sleepers that have the, you know, the equivalent of a modern day trench foot, you know, that they have a lot of dental issues with, you know, the substance misuse that they've been involved in, and really poor underlying health qualities that living on the streets would bring. So that's where we see the ICP as a fantastic, you know, advocate for working together as a partnership, using all our effective resources to try and tackle some of these issues. And, you know, then it's kind of led on for us as an organisation here at Nottingham City Homes. You know, what we're starting to do is build confidence and bring normality back to people's lives. So once we've rehoused them, we're putting all the wraparound support in. We can then look to start, you know, we've had some of these former rough sleepers on training courses now. We're starting to move them towards, you know, the labour market, where they, at one stage, not so many months ago, were so far away from it. So it's real positive outcomes that we're now trying to look into and really support people. And so far, again, it's been recognised by the MHCLG, which is the government body that looks after local government housing, as again another example of good practices and as an organisations that have come together, worked together, brought all their specialist resources together to deliver really sustainable, positive outcomes for its citizens. So the next one I want to talk about, Mars, is Nottingham On Call. This is a service that we have for those people that don't know, that can be referred into by care coordinators, district nurses, force teams, and people, you know, working in the health area. And what we do at Nottingham On Call, this is based at Bilborough. It used to be based on at the Woodlands in Radford. We're now moved out to our head office at Bilborough, and that's where it's now based. And it's an assistive technology that supports independence for vulnerable people. So the kind of list of the people that we would help, that this particular assistive technology service would be applicable for, are detailed there. And it's kind of interesting, you know, the work that we get in. We provide a full range of alarms, sensors, fall detectors, standalone equipment to suit all individual and customer needs. And what we have is something called the Not Go. This is like a pendant that's, you know, my mum has one, you know, that you can have and take anywhere in the country. And if you are in trouble, you know, your health, you have a fall or anything like that, just press a button, you come straight through to one of our assistive technology officers who will deal with you and get the relevant resource to help you and support you wherever we can. And I think, you know, one of the key things about this is, I've gone to probably the next slide here, Mars, please. It is staffed 24/7, 365, and we say, I put 25,000. It's actually 40,000 calls a month. A lot of them, many of them, 1,500 are considered critical. We support 7,000 people within the city to deliver to support people with this service. And we do things like we partner with social care and to help with quicker hospital and safe hospital discharges. So what we do, the Go service that we have is like a pendant that we put around, that you will put around a citizen's neck, that they will carry around the neck. It's recognized and established to call us. As soon as you press a button, it will come straight through to us. So it's a very simple way of getting support to people should they press a button, you know. And it is a GSM, so all it needs is a power base just to charge it up. I think about every 5 days it will need recharging, but it's a button there that we are trying to sell this, and it is going wide. You know, it costs £6.69 a week, but it has things in like a built-in falls detector, and as I say, it has nationwide coverage, and it is proving really successful. Other areas that we want to move our services into that we're just looking at is things like video reassurance, where citizens may have an iPad, for example. We want to be involved in that, where we can do the monitoring. And yeah, so you know, we are doing a lot around the assistive technology angle, whereby we can provide things that's monitoring systems, whereby people's daily living patterns can be monitored. So if people aren't moving, then an alarm will be raised with us, or we can raise it to a nurse or a member of the family. Or if people haven't, say for example, opened the fridge, we could put all this sort of monitoring, or not going to the toilet, things like that. You know, we could have a lot of monitoring systems in that will kind of offer value for money services. It will save somebody doing the actual physical check, and where we can be involved in there in supporting, and then we can notify whether it be the relevant nurse, relevant family member, if somebody goes outside the parameters of the service that we provide. I'm kind of running out of time a bit here, so next slide please, Mars. So other services we provide, I'm kind of just, I really try to sort of focus on the health angle where we can at the moment. We have a health and tenancy sustainment officer that kind of works as part of our rents team, you know, and they get involved in things like smoking cessation. Because for us, obviously, the more money that somebody has in their pocket, the more their ability to kind of pay the rent and manage the tenancy more effectively. So we get involved in things like that. We do a lot of campaigning around mental health, you know, through the social media, through individual visits that we do, and all the work that we do. You know, we've been involved in the COVID and the flu processes that have been happening recently. Kind of another area that we get involved that has a kind of more of a health aspect to it is kind of tenant involvement. We do things like fit in the community and green social prescribing. We're involved in things like family Zumba, because one of the things we've realised is there's kind of no point in just providing a Zumba class and hope people turn along. If a lot, you know, a lot of our, not a lot, but some of our citizens are single parent families, and if nobody's there to look after the children, we're never going to engage with them. So we would lay on side like Zumba classes, socially distanced Zumba classes these days, you know, classes for children, so they can be involved. So whilst we help the parents to get fit and become less socially isolated where applicable, we can also look after the children as well by laying on creches and everything in between, sort of thing. So we do things like boxercise in the community. We've recently set up a community dog walking service. So again, people that have got a dog that have been isolated, you know, we can get them to walk the dogs together and start making new friends, and you know, all the benefits of to the health that will bring. Tenancy sustainment, we do an awful lot around debt management to try and maximise people's income, to make sure that, you know, people can afford to live. You know, sadly, you know, we do have sadly we have minister, but sadly there is still a need for things like food bank vouchers. We work closely with food banks and we administer it. So if we come across somebody that's struggling with debt, that is struggling to feed themselves, we will issue food bank vouchers. At times we will collect food parcels for people and deliver them to those people that aren't capable of collecting themselves. Other things that we do, you know, we are geared around income maximisation. You know, interestingly enough, you know, in the past year alone, we've achieved £1.65 million in backdated benefits for people, you know, through things like PIP, personal independent payments. We've done things like that. The severe disability payments, we managed to get in and support our tenants to get £1.5 million in the last financial year in backdated grants. And we've been getting other grants in for things like furniture, white goods, because there's no point just giving somebody a home if they haven't got the furniture and the white goods that back it up. And we do let furnished tenancies as well, but if we haven't got that stuff to back it up, then the tenancy is going to fail and these people will probably end up presenting as homeless. So we are around doing a lot around sustainability. Just conscious of time, so probably just going on to the last slide. It's about our role in the ICP. You know, I think, as I've already said, there is such value of money to be gained by working in partnership. We're all getting, you know, pushed and squeezed and tight, and resources are going to become more and more scarce. So by kind of putting our resources together, we can deliver more bangs for buck for the citizens of Nottingham and out there. So that kind of links into the partnership working. I was trying to think, COVID response, we were involved in the COVID response. You know, we contacted every single one of our residents that lived in independent living schemes to make sure they were able to go and get the jab or sort out having their jab, and sorting out taxes and things like that. We're involved in care leavers, lots and lots of stuff, and I'm just conscious I'm running hopelessly over time as I normally do, Tracy, so apologies for that. But I hope that's giving you all a bit of a flavour of the work that we do here at Nottingham City Homes. Thank you. I think you're on mute.
Sorry, thank you, Richard. That was a fantastic presentation, and I've certainly learned an awful lot this afternoon, so thank you. We've got some questions coming in, and I know we've been joined by our lead of the Nottingham City ICP, Dr. Hugh Porter, for our questions, so a very warm welcome to Hugh.
Hi, sorry, I'm late.
The first question is around referral processes. So how does the referral process into your service work, and how can we actually link this better with wider healthcare community teams, so such as GP practices, community nurses, etc.?
Yeah, I mean, it depends on the individual. If they're a City Homes resident already, if they're one of our tenants already, then they're through the housing patch manager, for instance, or through their independent living coordinator. If they raise any issues we have, then we provide, we've got the outreach to contact the various support groups that are out there to do that. So it's a numerous ways. You know, if somebody is interested in something like the Not Go, they can contact us direct. You know, if they want the pendant that helps them support and live in the community and provide peace of mind, they can contact us direct. If you look at things like, you know, the hospital to home service, you know, we get discharge coordinators. We work incredibly closely with those at the two hospitals, OH referrals in, GPs. You know, it really is about contacting us, and it's normally through, you can contact us through our switchboard, our main number at Nottingham City Homes, and your call will be diverted through to the service that probably meets your need the most, Tracy.
Thank you, that's great. So we've got some more questions. So some saying what a great presentation, so thank you. one, thinking about sort of what are your objectives, priorities for the next 6 months? What are your key objectives as Nottingham City Homes, but probably more thinking around the ICP as well?
I think what we look to do, Tracy, there is move towards, making sure that the wraparound service for Housing First is secure, it's delivered. We have got more funding for the hospital to home service that we have. That is something that we're immensely proud of here in Nottingham. We are leading the way in the country, and when I set the service up, I was probably one of the main people to set it up. I managed to work my way through all the acronyms that health have. Health love acronyms, and it drives me bonkers, to be honest with you. That's my plea back to you all. But as I say, with regard to the ICP, that there are a lot we're doing about severe multiple needs and things like that. That's the agenda we want to work with the ICP partners. Look to see where, smoking cessation. I've now got a colleague that's going along to be trained by the health services team on that. We want to be involved. We want to be an active partner, and any way that we can help out, we're here to do it. And as I say, we do have the reach. So I probably haven't really answered your question.
No, that's great. And probably just bring Hugh in there as obviously our lead for the ICP. So Hugh, any thoughts, reflections around Nottingham City Homes' role with the ICP?
Yeah, thanks, Tracy. Sorry, I was a bit late. Got tired one of those mornings. So I mean, we're delighted. We're delighted that sort of City Homes is a partner for us. I've done work with City Homes and Nico over many years, and I think we are lucky to have such a great organisation, which has a real sort of service user focus, but also does have that breadth across the city. And some of the work Rich has done, that hospital to home sort of stuff, is really sort of cutting edge, fantastic stuff. I think it just give us a bit of insight of health can interact with the system wider than it's traditionally done so. And as Richard said, the problem is it's a bit sometimes that with our interactions with local authority, we have different cultures, a whole lot of different acronyms and sort of stuff. So Richard City Homes is an ALMO, but I know what an ALMO is, but actually most of the health people won't know what an ALMO is for these side of things. So we have our different acronyms, Rich, of course, for that side of things. But actually, there's a great opportunity to come together. And when I worked with some of the new housing and stuff you're doing, Rich, I think is really exciting. I know, and I think sometimes I'm not fantastically excited, but that wider sort of political environment that you operate in with MHCLG and sort of stuff, and the right to buy and all that. So you have a whole different set of challenges from the health sort of service, but you still manage to do some great stuff for us. And I just don't think we've leveraged each other's powers enough, and I chance to do that.
I absolutely agree with you saying, and thank you for your words, Hugh. There is more to come. It's interesting now when we're designing new buildings. We've done one at in the middle of Woodthorpe Park there, Winwood Heights. And we are taking, very much, and that is an extra care facility that we have. But we're doing things like hobby rooms now, games rooms. We've got so many different things that we get the benefits of health here and how we can help out, and what the impact that poor quality housing has on people's health, and what impact good quality housing has on people's health. So to reduce social isolation, the mental health issues that come from that, we get it. As I say, we have our activity coordinators that do everything from belly dancing lessons to decoupage to learn guitar to gardening. We do cover that whole remit because that's what our customers say they want. So this is what we're trying to get involved in these days.
Fab, thank you. And so then our final question, because we've just got 1 minute left, is really just around primary care networks and the work that we're doing around development. And this fits in nicely, really, as there's so much out there, and obviously share and learn is part of that. But how can we better understand each other's roles, Richard? We're really keen to get your views on that. How can we better understand each roles and know what support's available and work better together?
I think I'm due to give a talk to the primary care directors shortly. I'm not sure if it's today or not, but we'll see where that goes. But hopefully, I think it's about knowledge. I think it's about understanding what our offer is. We do have such a wide range of offers, that we can do. We can help people out. I think you could, the health colleagues can give the pills and the medicines and etc. to make people better, but it won't necessarily make the debt go away. That is causing it. We can do that. We can get the grants in for people. We can work with people on a one-to-one basis, So I think what we've got to do is make sure there's a really good, strong referral mechanisms from your service to my service, that we can do things like that. Because, as I say, things like debt won't go away without help and support. We need to be involved in that. And, you'll see it from one end, we'll see it at the other end, and poor food and the associated health issues that come from that. So if we can help support that, and I think what we've got to do is make sure that that there is robust referral mechanisms between the two, and that we are responsive to the needs of each other, really, to help the better outcomes, better lives for all our citizens here in Nottingham.
Thank you. So that probably concludes our Share and Learn. Is a really good place to end, really, about obviously our absolute ambition as an ICP to serve that population and to get better health outcomes and outcomes for individuals. So thank you everybody for attending today. Our next session is on the 4th of April, so do join us. We're going to be joined by Dr. Keith Gerlin to talk to us about hospital services in Nottingham. So thank you everybody.